నమస్తే, వెల్కమ్ టు ఆరోగ్య రహస్యాలు. ఈరోజు ఈ శీర్షికలో యాంటీనేటల్ కేర్ గురించి డిస్కస్ చేస్తాము. ఇద్దరు ఒకటే వేళ ఆ పెళ్లి రోజు 1000 మంది ఆశీస్సులతోటి వాళ్ళ జీవితం ముందుకు సాగాలని అనుకున్న భార్యాభర్తలకి ఆ భార్య ఏమండి నాకు ప్రెగ్నెన్సీ టెస్ట్ పాజిటివ్ వచ్చింది అని చెప్పే సమయం అతి ఆనందమైన సమయం. ఆ భర్తకి ఆనందం పట్టలేనంత ఆనందం ఉంటుంది. ఇలాంటి ప్రెగ్నెన్సీని మనం ఎలా జాగ్రత్త తీసుకోవాలి, ఎలా సంరక్షించుకోవాలి అన్న విశేషాలని మన నీలిమ గారు ఇవాళ మనకి వివరిస్తారు. మన నీలిమ గారి మాటల్లో విందాం.
Hello everyone, I am Dr. Neelima, consultant gynecologist at AHALYA Hospital, Guntur. Today I will be talking about antenatal care in pregnancy. Now, antenatal care is the care given to a pregnant woman from the time her conception is confirmed until her delivery. Each pregnancy lasts for around 9 months. Now, these 9 months we divide into 3 trimesters. The first trimester, second trimester and the third trimester. The first 3 months of pregnancy comes under first trimester, the next 3 months under second trimester and the last 3 months comes under third trimester. Now each trimester has its own importance and the antenatal care is different for each trimester because there are different physiological and anatomical changes taking place in mother's body and the baby itself. If I would have to talk about antenatal care, I would suggest you to start your antenatal care with a good preconceptional visit. Visit your gynecologist when you start planning for your pregnancy. Get your parameters checked, your hormones levels checked, your nutritional deficiencies, vitamin deficiencies, correct them and then plan for your pregnancy. Take a folic acid supplementation, your vitamins, your antioxidants tablets before you conceive. There are a lot of external factors which are governing the health of a woman. It is not like the same as it used to be 10 to 20 years before. Previously, antenatal care was once visit till 7 months, twice in 8th month and once weekly 9th month. Now the trend has changed because there are a lot of external factors which are governing the health of a pregnant woman before pregnancy, during pregnancy and after pregnancy. For example, late marriages, people getting pregnant at elderly age, infertility related issues, women getting pregnant with IVF techniques at an elder age, obesity, hypertension, thyroid, diabetes, heart disease, epilepsy. There are various other factors which are influencing the health of a woman. So pregnancies nowadays are more riskier than the pregnancies what we used to have in the olden days. So that is how the antenatal care has changed over a period of decades. Now antenatal care should be more precise, formulated one for every woman. The antenatal care regime should be different for every woman, every different pregnant woman, and for the same woman it should be different for 2 different pregnancies. Now once the antenatal woman comes to our clinic, we screen her for her high risk and any other background diseases and we advise her with the folic acid. Once the couple who is planning for pregnancy and woman misses her period, the only way to make sure that she is pregnant is to get a pregnancy test done. The simple and the easiest way to know whether you are pregnant or not is to get an urine pregnancy test done. Now once your test is done and you are confirmed with your pregnancy, what are all the changes you find in your body during the first trimester of your pregnancy? You can have your changes in your breast. Your breast seems to be more increase in size, more veins are prominent on your breast and the area around your nipple darkens. You will experience nausea and vomiting which will start around 5 to 6 weeks of pregnancy. Few will have peak of nausea and vomiting around 9 to 10 weeks, and this nausea and vomiting will subside on its own after 12 weeks of pregnancy. You have increased frequency of maturation around 8 weeks of pregnancy. This is because the womb puts pressure on your urinary bladder, and this will automatically subside around 12 weeks of your pregnancy when your womb becomes an abdominal organ. You will have symptoms of easy fatigability, you feel tired easily, you have generalized weakness. Now all these symptoms, you are missing of your period, nausea, vomiting, your breast changes, increased frequency of maturation, fatigue, tiredness, dizziness, all this you have to know are normal during your first trimester. Some are lucky enough that they don't have any symptoms at all, and some are unlucky who will have to continue with this nausea and vomiting even after 12 weeks of pregnancy. Nowadays, antenatal care is not only about getting your doctor's visit, you are getting your parameters checked like blood pressures, your hemoglobin checked, your sugars checked. It's not only about taking your medications, it is more of an holistic health care nowadays, where lot of other components have been added to the antenatal care. For example, like we have added stress management, lifestyle management, diet management, your yoga, exercises, prenatal yoga, pregnancy and childbirth related education we have added to this holistic health care of pregnant women. Antenatal care is more about giving social, mental, physical and emotional support to a mother during the journey of her pregnancy. Now all these other components put together into this antenatal care help us to get a better outcome of a healthy mother and the child. Now once you are confirmed with your pregnancy, people are very apprehensive about their first scan. Getting a scan done at the earliest will not serve the purpose. Getting the scan done at the right time will help us to identify a healthy pregnancy. So the correct time to get your first scan done is around 7 weeks, where by this time your embryo is totally developed and you can diagnose how many pregnancies you have inside your womb, whether it is a single pregnancy, twins, triplets or quadruplets as we usually encounter in our IVF pregnancies. And this scan we also help to diagnose high risk pregnancies like molar pregnancies, heterotropic pregnancies, and this scan is also called as a dating scan because this scan gives us the approximate date of your delivery, and this delivery date is more precise than any other delivery date on your subsequent ultrasounds what you take in your pregnancy. Now after your dating scan is over and you get confirmation of your fetal viability and you get your approximate date of your delivery, your doctor will schedule you with your next scan. Now your next scan will be between 11 weeks 5 days to 13 weeks 5 days, which is called as NT scan, nuchal translucency scan. Now in this scan, your sonologist will measure the fluid at the nape of your baby's neck, and this will confirm whether the fetus is within the normal percentile of that period of gestation. This was not done earlier in olden days, but because of increasing risk of Down syndrome, abnormal babies, high risk pregnancies, this NT scan has come into trend nowadays. And this is a must-go scan which all women should follow. The NT scan, you can call it as the first anomaly scan also, because in this NT scan we are able to detect many of your abnormalities in your baby. Neural tube defects, we will be able to find out the presence or absence of the nasal bone, your ductus venosus of your baby, single or double umbilical artery, and so on. Any of the major abnormalities you can detect in this NT scan. Now on the day of your NT scan, your doctor will suggest you with your maternal blood test. Now just getting an NT scan is not enough nowadays. Your doctor will advise to get a maternal blood test on the day of your NT scan, which will elevate the efficacy of screening of your baby. This is a biochemical screening which is done within 24 hours of your NT scan, and this will help you to rule out any chromosomal abnormalities in your baby. Now these are the two essential scans. The one is the dating scan, the other is the NT scan. These two scans are done in the first trimester. These scans can be done from two ways, transabdominal or transvaginal. Now transabdominal is done through your abdomen. For that you have to be with your full bladder. The other way is the transvaginal, which is done through your vagina. Transvaginal scan gives us more accuracy result than your transabdominal scan. Now after your scans are done, the next thing, couple are in confused state when they get pregnant. What to do and what not to do. Now what to do? Many women complain of food aversions when they become pregnant. Now what to eat and what not to eat. Anything which smells good to you, which tastes good to you, you can have anything. But usually at our home, it is said by our elders that if you are pregnant, eat for two. Now this is totally a myth. The only thing you have to do is increase your calories with 200 to 300 calories per day when you are pregnant. The only thing, divide your meal into 2 or 3 parts. Have small meals in frequent intervals. Because if you eat more at a time, you will vomit. So eat small meals in frequent intervals, whatever it might be, whether it is an apple or a banana or a toast, whatever it is, you have small frequent meals. Anything which is hygienic and nutrition you can have in your pregnancy, in your first trimester. Now anything which is raw, uncooked meat, please try to avoid those. As doctors, sometimes we suggest better to avoid pineapple and papaya in fruits because they have some chemicals which will initiate your uterine activity and will lead to abortions. So sometimes it is better to avoid papaya and pineapple and raw uncooked meat. Keep yourself hydrated. Have at least 3 to 4 liters of liquids per day, because you are more prone for infections, urinary tract infections in this time. So it is always better to hydrate yourself, whatever it is, in the form of your lemon water, your juices, coconut water or buttermilk. Don't drink liquids at once, because if you gulp, you will vomit, but if you sip, you won't. So keep in mind, try to sip liquids, not to have liquids at once. Now regarding traveling, it is always better to avoid traveling in your first trimester, because this sometimes leads to miscarriages. The next comes the lifting heavy weights. Now heavy weights is a big no-no during your first trimester. If you want to get back to in daily work, if you are a working woman, you can get back to your routine daily work until that work doesn't make you tired. Normal yoga, normal activity, brisk walking is okay during your first trimester, but strenuous exercises should be avoided in your first trimester. Now regarding your intercourse, you can always have your intercourse in your first trimester until and unless advised by your doctor not to do so in high-risk pregnancies. Now having said this, all do's and don'ts of your first trimester, the antenatal care, what all you can expect in your first trimester, the normal things of your nausea, vomiting, the breast enlargement, increased frequency of maturation, the fatigue, tiredness and all those things, keeping in mind what you can do, what not to do. Have a safe and healthy pregnancy. Thank you one and all.